Hello, 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 NCLEX Crusaders. Good afternoon. Welcome to NCLEX Crusade International. And today on our live training, we will talk about the SAARE method strategy. Professor, what is the SAARE method strategy? Well, it is only the best and most important prioritization strategies to answer NCLEX style questions that deals with the following scenarios. Have you ever seen a question that states, which patient will the nurse see first? Which patient will the nurse assess first? Which patient should the nurse delegate to the LPN, to the UAP? Well, this strategy, the SAARE method strategy, will help you answer those NCLEX style questions. So if you want to learn about this strategy, stay in tune, those who are seeing this live presentation, and for those who are reviewing this video later on, enjoy it as well, take a lot of notes and learn, because all these questions that we will be practicing today are above the passing standard NCLEX style question. Well, let's begin today's training. And like I mentioned before, we will talk about the SAARE method strategy. As I mentioned at the beginning of this live, you will see different style of questions in the NCLEX. You will see prioritization NCLEX questions. You will see questions that are not prioritizations, they are more content-based. You will see select or apply style questions. You will see hotspot style questions. Today's live is going to be about prioritization. Okay? Now, hear me out. When we talk about this strategy, the SAARE method strategy, you will be able to use it in those style of questions that ask you to prioritize between 4 different patients. Now, you can see questions that are more simple, questions that are kind of difficult, and questions that are very extremely difficult. But it doesn't matter the style or level of difficulty. If it says what 4 patients out of these 4 patients, which one you're gonna see first, which one you're gonna discharge first, you will be able to use this prioritization strategy. Now, here's the key. I'll give you an example of an easier level question where you can use this SAARE method strategy. Let's say it states, out of these 4 patients, which patient you will see first, and they give you a patient that has a stable condition. They give you another patient that has another stable condition, and another patient that has a stable condition, and the last patient is unstable. Well, that scenario, it is very easy, because if you have 3 stable patients and 1 unstable patient, who will you prioritize? That is very simple. You will pick the most unstable patient. That is an easy level question. How about a medium style question where you can use the SAARE method strategy? Well, let's say that they're giving you a scenario where you have 2 patients that have an acute condition and 2 patients that have chronic conditions. Which patients will you prioritize? Well, we know that an acute condition has the priority over a chronic condition. So this is like a medium level difficulty question. But sometimes you will encounter extremely difficult questions. Especially if you're doing very good on your exam, it's going to get very, very difficult. And those scenarios is, let's say, is telling you which patient will you see first, and they're giving you 4 scenarios, but now all of the patients have acute condition. all of the patients are unstable, which one is the priority? Well, you have to use other techniques and other critical thinking to prioritize in those scenarios. Another type of scenario that is very difficult. What if they give you 4 patients with pain problems? Which pain are you going to prioritize first? What if they give you 4 patients that have circulatory problems? What is the priority? The SAARE method can help you prioritize. And what is the SAARE method? What is that? SAARE only helps you to remember this. SAARE means stable versus unstable, acute versus chronic, ABC compromise, real versus potential, and expected versus unexpected. So that mnemonic SAARE helps you remember these words: stable, ABC, acute, real, and expected. So when you're facing this scenario, you will identify, what is the problem with my patient? Is this a stable or unstable patient? Does this patient have an acute or chronic condition? Does this patient have ABC compromise? And what is compromise? Is it airway? Is it breathing? Is it circulation? Do I have a patient that has a real problem, or do I have a patient that have a potential problem that there are no clinical manifestations? Or what are the clinical manifestations that I have on this scenario? Do I have a clinical manifestation that is expected in a certain condition, or do I have clinical manifestations that are unexpected on that diagnosis? This is the way to analyze this type of questions. So what I want to do next, I want to practice some scenarios with you. And it's going to be very simple. I will post a question here, and you will comment on the comment section your answer and why you think that is your priority. So as you're reviewing these questions, think of the concepts that I just shared. Comment your answer, and I will discuss the critical thinking behind each one of these scenarios. Thank you everyone that has decided to support our YouTube channel on every live. Thank you for those donations to our YouTube channel. I appreciate it very much. Let's begin. So our first scenario is this one. It says, a nurse is caring for 4 clients on the labor and delivery unit. Which of the following actions should the nurse take first? Well, as I described to you, we have 4 different patients with 4 different diagnoses or problems. And you have to identify what is the priority. What is my first action? Which patient I will see first? Answer number 1, it says, check the blood sugar of a gestational diabetic client. So answer number 1 is asking me to go check on a client with a diagnosis of gestational diabetes, and is asking me to check the blood sugar. But what I want you to think about is this. What I have is a diagnosis, gestational diabetes. But what is the problem now? Do I have any clinical manifestations that indicate that this patient is unstable? No, there are no clinical manifestations that I have any problems, that this patient is experiencing any problem. So for now, I don't think this is the answer, but I have to compare it with the other answers. So I'm going to compare 1 and 2. Number 2 says, assess the emotional status of a client who is post-spontaneous abortion. If we compare answer number 1 and answer number 2, answer number 2 is talking about an assessment of an emotional status. So this is telling me, go ahead and check on this patient's psychosocial needs. Whether on answer number 1, I am checking for the blood glucose level, which is a physiological need. So if I am deciding in between 1 and 2 only, I have not looked at answer number 3 or 4. I'm only looking at answer number 1 and 2 at this moment. Answer number 1, I am checking for a physiological problem, a physiological need, while answer number 2, in that scenario, I am doing an assessment of a psychosocial need because it deals with emotions. So between 1 and 2, if you're going to see those 2 patients first, who will you see first? Well, I will say check the blood glucose level first. There is no clinical manifestation of a problem, but I have to prioritize a physiological need over a psychosocial need. Therefore, answer number 2, I can already eliminate it. Now, let's compare answer number 1 and answer number 3. It says, assess the patellar reflexes of a client with mild preeclampsia. So now we have 2 diagnoses. 1, gestational diabetes, and 3, preeclampsia. But notice the word mild. Mild indicates that this is not a severe problem. So in between 1 and 3, they're both in the physiological range. They both have diagnosis, and none of them two indicates any actual problem at this moment or complications of gestational diabetes or complications of preeclampsia. So I will leave 1 and 3 there. I'm not going to do anything with them yet. I want to look at answer number 4 first before I make a final decision. And then it says on answer number 4, check the fetal rate, the fetal heart rate of a client who just ruptured membranes. So now we have a change in condition because this word just ruptured membranes indicates that something changed from a previous condition. Whenever they ask you to prioritize on an NCLEX style question and you see an answer where there is a change in condition that will prioritize, that will be the priority over any other answers where there is no indication of any physiological problem. In answer 1 and 3, I am looking for problems. I am looking to see if the blood glucose level is high or too low. In answer number 3, I am looking to see if there are any complications that indicates that this patient went from preeclampsia to eclampsia, but there are no clinical manifestations of any problem. But answer number 4, there is a change in condition in between 1, 3, and 4. 4 is the correct answer. Why? Why is this the correct answer? And why do I have to check fetal heart rate? Well, first of all, fetal heart rate is airway, breathing, circulation. We're talking about the fetus circulation. We're talking about the fetus heart rate, the fetal heart rate. And also, because there is a changing condition, the nurse must see and assess that patient first. Why? The patient could develop a complication known as umbilical cord prolapse. And how will I determine if this is happening? By doing an assessment, by assessing the mother and assessing the fetal heart rate. It is very important when you're analyzing these questions that when you pick your answer, you think why. Why is for my correct answer, and the most important thing to do what I just did. You have to learn how to compare, because the higher the difficulty of the question, the harder it is to see these changes. So you have to learn how to identify those keywords. Like an example in answer number 4, the keyword is, or the keywords are, just rupture membranes. All right, awesome. Let's go to the next question. I hope you're enjoying this live training, because we are giving you guys, we are giving you an excellent tool to change your thinking and improve that critical thinking that it is not needed, required to pass the NCLEX. Let's go to the next question. It says, a nurse on an inpatient psychiatric unit receives report at 1500 hours. Which client would the nurse need to assess first? So we have a prioritization question. The nurse is receiving report at 3 p.m., 1500 hours. Which patient will you assess first? Answer number 1, a client on 1-to-1 status because of active suicidal ideations. Answer number 2, a client pacing the hall and experiencing irritability and flight of ideas. And I want you to pay attention to these verbs. First, pacing and experiencing. This indicates that we have an active problem. So let's compare answer number 2 with the other answers. Answer number 3, a client diagnosed, notice the verb diagnose, ed ending, which represents the past, with hypomania, monopolizing time in the milieu. See what's going on with this camera? It's kind of like blurry. There you go. Now what we're talking about. So a client diagnosed with hypomania, monopolizing time in the milieu. And answer number 4, a client with a history of mania who is to be discharged in the morning. So what is the relationship between the verbs in this question? I love to put attention to verbs. What are the verbs saying? Is it the present, the past, or the future? Like I said on answer number 2, we have the present, a present problem, pacing and experiencing. Answer number 3, diagnosed of hypomania. So that is a diagnosis, and the problem now is monopolizing time or controlling time. Okay, so we also have that verb ing in answer number 3. And answer number 4, it says, who is to be discharged when? In the morning. In other words, tomorrow. So what do you think has the priority, now or tomorrow? If I am looking for the most important patients to see, for the most acute problem, for the patient that is with the biggest problem or medical condition, If a patient is going to be discharged and tomorrow, that is not a problem. So answer number 4, I think, is the first answer that we can eliminate. 1, 2, and 3. Some nurses, when they are analyzing this question, they look at answer number 1 and they think, active suicide ideations. So this is a safety problem. I gotta see that patient first. No. The reason why the patient is currently on 1-to-1 status. What does that mean? A patient that is on 1-to-1 has a staff member supervising this patient at all times. So this patient is on 1-to-1 24 hours a day. So unless it indicates that this patient is out of control, actively right now, like trying to kill themselves, and the staff member that is with that patient cannot control the problem, then that is not going to be my priority, because the patient has a diagnosis, we are in a psychiatric unit, the patient is inpatient and already has a member supervising this patient. I do not need to prioritize that patient first. So answer number 2 and 3 is what we have left. You need to understand this. Now, if the patient, it will say that the patient is doing something and trying to kill themselves and there is no 1-to-1, then that is a big safety problem. We have to take care of that already. But this is not the scenario. We are in a psychiatric patient unit. We are on a 1-to-1 status. That is controlled already. So answer number 1 is a stable scenario. Now, between 2 and 3, we have 2 problems happening at the same time. One patient is pacing the hall. What does this mean? Going back and forward. So this patient is agitated, is experiencing irritability and flight of ideas. Flight of ideas means they're like overthinking, thinking of multiple things at the same time, probably like talking multiple things at the same time. So this patient is out of control. And you may say, well, this patient could be like that all the time. I don't know that. All I know is that right now I have a patient that has the potential to cause problem because the level of anxiety is extremely high on this patient. If I compare answer number 2 and 3, answer number 2 has the priority. Why? Because answer number 3, a patient with hypomania monopolizing time, that is expected on that client's condition. Notice the difference between 2 and 3. Answer number 3 has a diagnosis, hypomania. What are the clinical manifestations? Monopolizing time. What is the relationship between hypomania and monopolizing time? It is expected in that condition. And notice in answer number 2, there is no medical diagnosis. I cannot identify if this is expected or not expected in a certain condition because I don't have a condition. That is the patient that we need to assess first. You see, the SAARE method, identifying stable, unstable, acute, chronic, expected, unexpected, ABC compromise like the previous scenario, it is super important to learn how to prioritize this style of questions. And notice, I did not pick very difficult questions because what I want you to know, I want you to learn the strategy and the critical thinking first. Because if I put a bunch of difficult questions here, you will get lost and you would not learn the strategy. All right? Excellent. You want to continue practicing? Watch it. See another scenario and think critically together. Let's go to the next one. But I want to share some information with you. If you're new to our YouTube channel, go ahead and subscribe to our channel right now. You don't want to miss any information. So do it. If you have not subscribed, subscribe to the channel. That way you can comment on the comment sections, because the comments in our videos and our lives are only for those who are subscribed. This is a way that we found to kind of like block some of the scammers and people that want to share links and stuff that are out of control. So go ahead and share, subscribe to our channel, and most importantly, like our video. If you have found that this video is helping you, go ahead and like this video, comment, leave us a comment. Professor, I liked it. I looked at these answers. I think this is the answer. Even if you're watching this video later on, it doesn't matter that you're not live. You can always like and comment our videos, and of course, share it with other nursing students around the world that need help with NCLEX preparation. So let me see if you are liking the video. Wow, we have 158 likes. Excellent. There are right now 323 live nurses listening to this training. Go ahead and find that like button and like it. This is your way of showing appreciation to our channel, and it's gonna help us a lot for our videos to show on other nurses' feed, so they can also learn from this training that I am providing to you. Also, our advisor, they're gonna be putting in the comment section some links, okay? If you are a nursing student, let's say you have the NCLEX soon and you want to practice some questions together with us every week, different times of the week, different days of the week, we practice some questions together on Zoom. If you want to receive information about those Zoom live classes, you want to learn how you can register to them, our advisor is putting the link on the comment section. Go ahead and click that link so you can join this Telegram group where I share the information about our live Zoom classes. But if you are not interested in the live classes and all you want to do is receive notification whenever we are live on one of our YouTube trainings, whenever we put a YouTube video, go ahead and join the other Telegram group that says NCLEX Crusade International YouTube training. That is completely free. All we're gonna do is share the links to those videos, to the live training, so you don't miss any of the information. Okay? All right, let's practice one more question. Let's practice the SAARE method strategy on the following question. Here it is. It says, a nurse is caring for clients in a long-term care facility. Which client should the nurse assess first after receiving the morning report? So we're dealing with a scenario that two nurses are giving report to each other, and we got several problems going on at the same time. The nurse is saying, one of your patients is a client diagnosed with Parkinson's disease, and here's the key word, who began to hallucinate. What does this word began means? Once again, change in condition. The patient has a chronic diagnosis, Parkinson's disease. But what is going on now? The patient began to hallucinate. Why the change in condition? What is going on? I don't know. I just came on duty. I have to find the most unstable patient. So for now, answer number 1 looks very good because there is a change in condition. Answer number 2, the patient's diagnosed with congestive heart failure. This is also a chronic condition. So notice 1 and 2 both are chronic. Parkinson's disease, chronic. Congestive heart failure, chronic. And 3+, pitting edema. Oh, now we have a difference. Hallucination, new hallucinations with Parkinson's, this is chronic, but this is unexpected. While answer number 2, it is chronic, but edema with congestive heart failure is expected. And you may think, Professor, but edema has to do with circulation, and circulation is physiological, and that is priority. Not in this scenario. Why not? Because I have another patient that is worse. Why is the other patient worse? Because there is a change in condition, and that change in condition is not expected in this patient. Something new is going on. So chronic change in condition to a unexpected condition has the priority over chronic expected. So answer number 2 is eliminated. Answer number 3, patient with Alzheimer's disease who was found wandering in the hall at 2 a.m. So what is the relationship here? Chronic expected, because a patient with Alzheimer's disease is expected to be confused, wandering around. So if I compare answer number 1 with answer number 3, there is a change in condition in answer number 1 that is unexpected, while answer number 3 is chronic expected. So I eliminate answer number 3. And now I have to compare answer 1 and 4. Number 4 says, the client diagnosed with terminal cancer. We got another chronic condition here, lost 8 pounds. That is expected in terminal cancer. And the weight loss has been since the weight was taken 4 weeks ago. In other words, the patient has lost 8 pounds in 4 weeks. Well, answer number 4 is chronic expected. That does not represent a priority over a patient with Parkinson's disease who began changing condition to hallucinate. Well, NCLEX Crusader, thank you very much. Thank you for joining this YouTube live. See you on the next one. Stay in touch on our Telegram group. Make sure you're subscribed so you don't miss the next live, because I will be discussing with you another prioritization strategy that is called Maslow's Hierarchy of Needs strategy. An excellent tool to bring to your NCLEX day and improve your critical thinking and become a registered nurse or a licensed practical nurse, whatever exam that you are presenting. Thank you very much. Thank you for trusting me. Thank you for giving me the opportunity to teach you. God bless you all. Bye-bye.